Hey guys, I'm Shamila from Miller Med Talks. So I'm going to quickly go through how I usually conduct a meds check in the pharmacy, also known as a diabetes med check, depending on if the patient is diabetic or not. So basically, this is funded through the 6 CPA Community Pharmacy Agreement. So I'm talking about Australia in all of my videos, just so everyone's aware of that. So the government basically provides us, the pharmacists, with funding in order to basically prevent medication errors, increase quality use of medication, and make sure that the patient has a good understanding and is getting the most out of their medication. So how do I do this, and how do I do this effectively without being a burden to the workflow? Okay, so I will go down with the patient's medications. I'm just going to say, use the most common term, Mrs. Smith. Hi, Mrs. Smith. I'm Shamila, the pharmacist on duty today. Just wondering if I can just ask you a couple of questions about your medications, just to make sure everything's going okay. So there you go. That's my lead. Yes, I don't come across saying I'm going to conduct meds check. That's boring. That you've already lost them. Okay, you need to show that you're interested in how their medication is going for them. You just want to have a conversation, and 9 times out of 10, the customers love speaking to the white coat, right? So you go down, how your medication's going, tell me about it. Have you been taking them every day? Before you know it, your meds check has already started. Yep, so you can either keep it logged in your head. What I usually do is when I go down, I will go into Guild Care or, oh my God, it's been a while, or MedAdvisor, yes, and I will print out the template. So I've got it printed out there with their prescription history and what they've had. So how's it going? I'll pick up a medication. Have you been taking your XYZ, whatever it is? She'll say yes, no. Okay, how come? Why not? Can you explain to me the reasons why you haven't been taking it? Or I try to use open-ended questions, but at the same time, we need to be time effective. So depending on what medication it is and the importance of the question, I will gauge whether it's going to be open or closed. Yes. And also depending on how many staff numbers we have on at the time, and if there is another pharmacist on duty or not, and the complexity of the patient's medication regime will depend on what sort of questions I ask. So I've got the template. Before you know it, we're already doing a meds check. Okay, you're taking this. Tick, tick, how's it going? Have you been taking it with food? If it's metformin, how are your energy levels going? Have you been getting any diarrhea? So any main points, I guess, related to that certain medication, I will try and extract out of the patient in a time-efficient manner. The next thing I will ask is, do you want to discuss anything else while I'm here? Yes, no, I will gauge on what they're telling me and respond accordingly. If the patient takes high blood pressure medications, I will grab one of the pharmacy students or the intern and say, look, Mrs. Smith, while you're here, I just actually want to check up on how your blood pressure is going. So I will grab staff member to take you down the back and they'll inform me of what it is. Is that okay with you? Patient will generally say yes because they're happy that you're showing a genuine interest. So I'll go through the medications, ask them some key questions, give them an opportunity to provide me with any information that they want to extract or clarify. If they're taking quite a few medications, I might suggest a Webster pack, so a dose administration aid to increase and enhance their compliance. And look for other things of look at other interventions that I can do that can make their medication management a lot easier. I'll also wrap it up with a few lifestyle things. So how's your diet going? A diabetic patient could be drinking Coke every day. Now, we assume that they know this is bad, but we need to reinforce this as well in a non-threatening manner. So just a couple of things. I would say, Mrs. Smith, next time you come back, I'd like to go through your diet. Did you know that, might state some statistical facts here. Did you know that by reducing your weight, it can increase XYZ on whatever condition you're talking about. So always leave with a few positives. You don't want to seem like you're hounding them and getting them in trouble. So you want them to realize that you're on their side and you're trying to make their life a better, happier one by all this information that we can give to them. So yeah, that's sort of how I do a quick meds check. Obviously they've got to sign the waiver, so I'll just say, because I've extracted your medical history and your prescription history and we've gone through your medications today, I'm just going to get you to sign here. Would you like a copy of your report? If the patient's not in a rush, they generally do want a copy, and I always say it's a really good idea just to keep it somewhere accessible in case you have to, in an unforeseen emergency, go to the hospital or something like that. You can grab it off the fridge nice and easy. If you see another doctor or a specialist, at least you have everything in that one document. Most of the time they'll want to wait. If I'm completely flat out and there's no other pharmacist on duty, I'll say, okay, Mrs. Smith, are you coming back here later today, or will you be passing by throughout the week? If they say yes, I'll say, great, I'll have your report ready for you in an envelope, and you can pick it up then. And then I do the cleaning on MedAdvisor and the data collection, which is now another component that the 6 CPA has allowed the pharmacist to do. So your data collection is about $33. Your MEDSCHECK is about $64, unless it's a diabetes one, and then that's about 90 something.